Hikka means hiccups in Sanskrit language. The herbs which are having the property of relieving hiccups are called Hikka Nigrahan herbs. Even though diaphragmatic irritation is the main cause for hiccups, psychological factors are also involved like stress, irritation, depression, etc. So, the herbs have systemic effect as well as soothing effect over the diaphragm and also regulate the psychological disturbances can help to treat hiccups. Here are the top 10 Ayurvedic anti-hiccup herbs. Number 1. Shatti or spiked ginger lily or Hidicium spicatum. It has soothing, carminative, digestive and anxiolytic effect. Number 2. Pushkarmul or Indian elecampane or Inula racemosa. It has expectorant, antitussive, analgesic, bronchodilator and antispasmodic effect. Number 3. Badar or red date or Gigifus jujuba. It has digestive, cardiac tonic, stabilizer and absorbent effect. Number 4. Kantkari or Solanum xanthocarpum. It has expectorant, antitussive, analgesic and anti-inflammatory effect. Number 5. Briti or Solanum indicum. It has analgesic, anti-inflammatory, digestive and expectorant effect. Number 6. Vrikshru or Dendrophtha falcata. It has anti-inflammatory, analgesic, antispasmodic and antipyretic effect. Number 7. Haritaki or Chebulic myrobalan or Terminalia chebula. It has laxative, rejuvenative, antioxidant and appetizer effect. Number 8. Pipli or long pepper or Pipa longum. It has liver stimulant, expectorant, antitussive, bronchodilator, digestive and carminative effect. Number 9. Dullab or Khorasan thorn or Phagonia critica. It has antitussive, anti-inflammatory, anxiolytic, vasodilator and blood purifier effect. Number 10. Kulir Shrungi or Rus succedanea. It has expectorant, immunomodulator, bronchodilator and digestive effect. Qualities. Most of the herbs of this group are pungent or bitter in taste, hot in potency and undergo pungent kind of metabolic change. They act as an expectorants, bronchodilators, antitussive, immunomodulators and soothing agents. Due to these qualities, they have direct action over the Pran, Udan and Vyanvat, which are the key factor in the causation of hiccup as per Ayurveda. Therapeutic uses. The herbs referred here are effective in cold, asthma, hiccup, chest congestion, mild heart diseases, diseases of the chest and lungs, etc. They can be used effectively in the management of some of the psychological disorders where mental irritation and dissatisfaction is found. Contraindications. These herbs are having the indirect effect over some of the sympathetic and parasympathetic nerves. Hence, the herbs should be administered with caution in neurological disorders. How to take The herbs like Shati, Pushkarmul, Pipli or Haritaki can be made into fine powder and administered along with ghee or honey based on doshic dominance. They have good benefits over hiccup and associated complaints like headache, cold, cough, hoarseness of the voice, etc. As hiccup is a most irritating kind of health issue, patients like to have instant relief. Also, few of the medicaments themselves may provoke the hiccups, and hence the herbs can be modified into lozenges or chewable tablets. Syrups as well as linctus can also be prepared out of these herbs by adding few necessary ingredients. Hope this information brings health in your life. Thank you.